Hello, Madison. What can I do for you today?
Hello, Doctor. I would like to get rid of this scar on my right arm. It's really ugly, and I can't bring myself to wear short sleeves, even when it's really hot and I'm out and about. Could you get rid of it?
Okay, it looks like quite a bad injury caused it. What happened?
When I was in year 10, I was in a car accident. My dad was killed. So every time I look at the scar, all I can think about is my dad. Can you make it go away?
Firstly, I'm very sorry to hear that. It must have been a very difficult time for you. Let's have a look at it. Okay, Madison, the scar is quite extensive, but I feel confident that with surgery it will greatly improve its appearance, but I won't be able to remove it completely. Also, you will be left with some residual abnormality there.
Abnormality? I don't want an abnormality. Can't you just get rid of it?
We can certainly improve its appearance, but I'm afraid it's never going to look the same as your other arm.
But it will look better.
Oh, it will certainly look better. I can promise you that.
How do you do this sort of operation?
Let me show you. So what we will do is we will excise around the scar tissue, and then we will rejoin it in this shape.
So the edges will join together okay?
Yes, you will have plenty of stretch in your skin, but you will be left with a slight zigzag looking scar, though it will be very subtle. What do you think?
Yes, I want to do this. Just so long as the horrible thing's gone.
Okay, there are some risks involved, though very slight. It is possible.
What sort of risks?
Well, anaesthetic has some risks, though very unlikely in a young, fit patient like yourself. Surgery has some risks, such as bleeding. Again, very unlikely, as we're not going near any major blood vessels. Infection is always possible.
What would happen if it got infected?
We'd give you some antibiotics to help clear it up. Rarely you might need an operation to help clean it up, but again, this doesn't happen very often. Any other questions?
How much will it cost me?
Do you have private cover?
Yes, full top cover.
So your costs will not exceed $1,000, but it will be closer to around $500.
Okay. Thank you, Doctor. I think I will go ahead if you could book me in, please. Actually, I also have a mole on my shoulder that seems to have gotten bigger recently. Could you cut that out while you're there?
Certainly, let's take a look. Would you like me to get the nurse to chaperone?
Oh, no, it's fine.
Okay. Okay, it doesn't look too suspicious, but I would recommend that we remove it at the same time, and we'll send it away for testing.
To see if it's a cancer?
Exactly. It's unlikely, but we want to be sure. Okay. I'll get the nurse to make the booking for surgery, and she'll be in touch with some dates.
Okay. Thank you, Doctor.
You're very welcome.